You know, it's really concerning because we have nobody to turn to, nobody.
Nora Ledoux is a member of the Ross River Dena Council in Ross River, Yukon. Like many in the small community of 400, she has a family member in crisis. Since the early 90s, her loved one has struggled with mental health and addiction issues.
You know, this person has 3 kids. They're afraid. They don't know what's going to happen.
There are no doctors or counselors who live in the community.
We need treatment centers, we need more support, there's so many things that we need, right?
Dave Peterson is a trauma support worker at the Margaret Thompson Healing Center in Ross River. He says the center receives limited funding and is only reaching 5 to 10% of the community.
The rest we can't reach because we don't have the capacity to do it.
The one thing that's holding everything back is the lack of resources. It always goes back to that.
Dylan Loblaw is the chief of the Ross River Dena Council. He says it's not easy for some members to travel outside of Ross River for treatment, especially as there's no transportation services. That's why he wants Yukon government to provide more programs and supports within the community.
If we could get those services and those facilities in place and managed and operated by the nation, it would be real beneficial, and it would also benefit our counterparts as well.
In each community we visit, the needs are different. You know,
Cameron Grandy is the director of Yukon government's mental wellness and substance use services. He says counselors from a neighboring community visit Ross River bi-weekly and a mental health support worker is available, but he understands the community's concerns that it's not enough.
But it absolutely is a priority, so I don't disagree that that having somebody in the community is our goal.
Grandy says staffing has also been a challenge. A mental health nurse in Ross River is currently on leave, and the department has struggled to fill a mental health worker position in the community.
We have a full-time position in Ross River, and we will continue to try to fill that full-time position.
But Loblaw feels there's a lack of urgency, and Ross River is not being seen or heard.
It's kind of concerning because some of the members aren't able to get what they need.
As for Ledoux, she says it's time for governments to start investing in rural communities so families like hers can heal.
You really need to look at the big picture and start planning. It's going to take a lot of money, but then you're going to be saving in the long run your own people.
Sarah Connors, APTN National News, Ross River.